Can ultrasound predict the return of bowel function? This study by Gurian et al. Discusses the use of bedside abdominal ultrasound to confirm intestinal motility in neonates with gastroschisis. This study had 17 patients with uncomplicated gastroschisis, and they assessed the return of bowel function using both ultrasound and clinical markers. They performed ultrasound starting on post-op day 1 in all of the patients and assessed for peristalsis. Full motility was defined as peristalsis in all 4 quadrants. At the same time, clinical markers were also used to determine the return of bowel function, and these were bowel movements, gastric residuals, and the characteristic of the NG tube output. They found that ultrasound predicted the return of bowel function at the same time as clinical markers in uncomplicated gastroschisis. They also reported that in one of their patients, feeds were started when they met clinical signs of return of bowel function, even though the patient did not have peristalsis on ultrasound in all 4 quadrants. This patient had emesis and feeds were discontinued. Although the sample size is small, this study proposes a potential objective tool to assess the return of bowel function in uncomplicated gastroschisis patients.